You've been together for 20, 25, 30 years. You raised the kids, built a life, achieved things together. But in bed, the spark went out. And you wonder, is this just how it is? Is this normal? Does sex really die in long-term relationships? Or are there myths about sexual relationships that are sabotaging your intimacy? Today I'm going to debunk 7 myths about sex in relationships after 50 that affect millions of Brazilian couples. Get ready. Let's go. Myth number 1. After 20 years of marriage, it's normal to no longer have sex. It's not. Frequency can decrease, yes. But disappear completely? That's not normal. A study from USP with 1,800 Brazilian couples 50+ showed 58% maintain an active sex life with a frequency of 1 to 3 times per week. Only 12% report total absence of sex. And when they investigated these 12%, they discovered 76% had unresolved problems. Old resentments, lack of communication, ignored health issues, or they simply gave up without trying. Sex doesn't vanish because of time. It vanishes due to lack of conscious effort. If you and your partner stopped having sex, don't accept it as normal. Investigate together. Truth. Sex can and should continue in long relationships. Total absence isn't normal. Next myth. Myth number 2. Men always want more sex than women. Not necessarily. A surprising Brazilian study revealed after 50 in 34% of couples, the woman has more sexual desire than the man. Why? Menopause can boost libido in some women. No. Pregnancy worries. Fewer responsibilities with children. Men after 50 may have reduced libido due to work stress, low testosterone, medications, fatigue. The stereotype of men always want it isn't an absolute truth. Sometimes, it's the woman wanting and the man tired, and this creates unnecessary tension when the man feels guilty or pressured. Truth. Sexual desire doesn't follow stereotypes. It can be higher in women. Next myth. Myth number 3. If you always have sex the same way, desire will die. Not an absolute truth. A study of long-term couples revealed something interesting. Couples with routine sex, but strong emotional connection, 76% sexual satisfaction. Couples with varied sex, but no emotional connection, 42% satisfaction. Routine doesn't kill desire. Disconnection kills desire. You can have sex the same way for 20 years and still feel pleasure. If there's intimacy, affection, attention, and connection. The problem isn't the position, it's the lack of emotional presence. Of course, novelty can help, but it's not mandatory. Truth, routine doesn't kill desire. Emotional disconnection does. Next myth. Myth number 4. Couples don't need to talk about sex. It should be natural. False. Communication about sex is essential, especially after 50, when the body changes. A study showed couples who openly discuss sexual preferences, 82% satisfaction. Couples who never talk about sex, 38% satisfaction. Why? Because after 50, sex requires adjustments. More. Foreplay. Different positions, knees hurt. Lubrication, menopause, different timing, morning might be better than night. If you don't talk, you don't discover. And each person stays frustrated in silence. How to start the conversation. Choose a moment outside the bedroom. Talk about what you want, not what you dislike. Use phrases like, I would love if, instead of, you never. Truth. Communication about sex greatly improves satisfaction. Talk. Next myth. Myth number 5. If you need to, schedule sex. It's no longer romantic. Nonsense. After 50, with a full routine, work, grandchildren, commitments, spontaneity is rare. And waiting for it means almost never having sex. A couples therapy study demonstrated couples who schedule sex, e.g. Friday night, frequency of 2-3 times per week. Couples waiting for spontaneity, frequency of once a month or less. Scheduling sex isn't less romantic. It's being intentional about something important. Do you schedule romantic dinners? Schedule trips? Schedule family activities? Why would sex be any different? Intentionality is the new romance. Truth. Scheduling sex isn't less romantic. It's being mature about intimacy. Next myth. Myth number 6. If my partner refuses sex, it's rejection. Not necessarily. A sexual psychology study revealed, in 78% of cases, when a woman declines sex, it's not personal rejection. It's genuine physical exhaustion, pain, menopause causes dryness, emotional stress, or simply not being in the mood at that moment. Men tend to take refusal as a personal attack, and this creates resentment, which pushes the couple even further apart. How to handle it? Don't take it personally. Ask, what do you need to feel more comfortable? Offer affection without expecting sex. Show that intimacy isn't just penetration. In many cases, when the woman feels less pressure, she relaxes, and desire returns naturally. Truth. Sexual refusal usually isn't personal rejection. Don't take it emotionally. Final. Myth. Myth number 7. If there was no penetration, it wasn't real sex. False. After 50, sex can and should include many other forms of intimacy. Extended foreplay, sensual massages, oral sex, mutual masturbation, simply touch and affection. A sexual satisfaction study showed couples 50+ who define sex only as penetration, 52% satisfaction. Couples 50+ who include other forms of intimacy, 81% satisfaction. Why? Because penetration can be difficult or uncomfortable due to erectile dysfunction, vaginal dryness, joint pain. But physical intimacy doesn't need to stop because of that. Expand your definition of sex, and you'll discover you have way more options than you thought. Truth. Sex isn't only penetration. Intimacy has many forms. Recapping the 7 myths. First, sex doesn't naturally disappear in long-term relationships. Second, women can have more desire than men after 50. Third, routine doesn't kill desire. Emotional disconnection does. Fourth, communication about sex is essential, not embarrassing. Fifth, scheduling sex isn't less romantic, it's intentional. Sixth, sexual refusal usually isn't personal rejection. Seventh, sex isn't only penetration. Intimacy has many forms. What does this mean? Sexuality in relationships after 50 depends on open communication, intentionality, not waiting for spontaneity, flexibility, adapting to body changes, emotional connection, more important than technique. Drop in the comments, which myth surprised you most? If this video helped you, hit that like button. If you know someone who needs to see this, share it with your partner. If you want more content about relationships and men's health, subscribe to the channel. See you in the next video.